everyone. Welcome back to another episode of Color of Money, where I, your host, Grace Coughlin, pull back the curtain on the lives and lessons learned by entrepreneurs to understand how to generate that first dollar. Today, I'm super excited to welcome Kaitlin, a female entrepreneur in the space, so let's welcome her.
Hi, everyone.
Hi, Kaitlin. How are you?
Good, thank you. How are you?
Great. So excited to have you on today and just to learn a little bit about you. Do you want to just give us a kind of a 30-second overview of who you are and what you're doing?
Sure. I'm Kaitlin. I'm co-founder and CEO of Reia. We are developing a non-surgical treatment for pelvic organ prolapse, a condition that affects 50% of women over the age of 50, where their pelvic floor muscles can no longer support their uterus, so they'll begin to descend. And we are looking to create a non-surgical treatment option that enables access to care, even in remote locations, because it enables self-management, so people can really regain their own quality of life and independence in their healthcare.
That's amazing. Thank you so much for sharing. So before we get into it, I like to do a little fast five to show some color in your life. So let's just get started. What was the last gift you gave somebody?
The last gift I gave someone was a Japanese toilet seat.
Interesting. Okay. Any specific reason for that?
My husband and I really enjoyed our trip to Japan, and I thought it would be a gift that he would be most surprised about. Because
that's awesome. I love that. I love that. Okay, next question. If you were an animal, what would you be and why?
That is a good question. I think I would be a black bear because they generally are extremely cautious, and they often like to gain better perspectives by climbing up into a tree and like seeing the entire surroundings before making a decision and approaching something that has originally spooked them by going up there.
Interesting. No, I love that. That makes total sense. Would you say you're more of a morning or night person?
Definitely a morning person.
Morning person. Okay. And if you could choose between flying and mind reading, what do you think you would choose?
I think I would have to go mind reading because I am a bit afraid of heights, and I don't know if flying would really resolve that problem.
Love that. Love that. And lastly, what is an unpopular opinion you hold?
An unpopular opinion that I hold. That's also a great question. I would have to say that generally everyone walks too slow, and that
I hate slow walkers. I agree. Yep. Love that. Okay, so let's kick into things. I would love to just kind of start off by seeing what made you take the leap to, start your own startup. If you could tell us like how old you were when you do it, what was going through your head, what made you just make that initial jump into, the entrepreneurial world.
Yeah, absolutely. So I have kind of an interesting start to our company. So this actually started with two of my classmates at Dartmouth while we were in our last year of engineering, and we did an independent study where we were interested in redesigning tools used in gynecologic health. And so this is kind of where we got connected with our fourth co-founder, who is a urogynecologist and works with pelvic floor disorders, which is kind of how we came to the conclusion this is the area we wanted to address. But at the time, we really just were kind of like more focused on how we could solve this engineering problem because that fit in with our coursework at the time. But upon graduation, we were still very interested in kind of solving this problem in the work we had started. So we began kind of having this percolate in the back of our minds, spend some nights and weekends on it until we kind of got to this stage where we decided to really go for it and apply for our first grant from the NIH. So I was 25 at the time. And that is, so we had kind of other jobs while we were in the process of this application. So when it was awarded, we were fortunate to be able to kind of jump and make the leap to full time. So this ended up being in the beginning of 2019. So yeah, nearly 5 years ago is where we have really been fully committed to this and kind of like started over and have expanded upon the other aspects besides just kind of the engineering problems of how you actually run and develop a medical device company.
Yeah, that's amazing. I would love to go back to, you guys said you were doing other jobs at the time because there's always, that uncertainty that you want to get the grant or something like that. What were you doing during that time?
Yeah, so I was working for a boutique consulting firm that focused in intellectual property and technology. So we helped evaluate and license patent portfolios and buy and sell patent portfolios.
Awesome. Yeah, I feel like it's hard to, kind of fully just like, especially since you had just graduated from Dartmouth, fully just dive into that without something to kind of fall back on. Like you never know what's going to happen, right? So, obviously you had that, which is great. And I'm sure you learned valuable things from that job as well.
Yeah, absolutely. I would say that having an understanding of the IP landscape was really informative for some of the steps that we ended up having to do. And then, yeah, having saved up a couple years of salary was also helpful.
Doesn't hurt, yeah.
Were, in between our slight funding gap. So that was also very nice.
Yeah, that's great. And how many co-founders do you have of your company?
So there are 4 of us. And
there's 4 of you. Got it. Yeah. So do you feel like they've been like very big supporters with you and in your journey? Do you feel like it wouldn't have been possible without them?
Yeah, this absolutely has been a team effort. I would say that everyone really complements each other, even though 3 of us had come from the original background of all being engineering students together. I feel like everyone has really kind of developed into different roles, but because of this like understanding this foundation really knows how to support each other because we've been working together since we've been doing class projects since our freshman year. So
yeah, no, that's great. It's always great to have a solid support system of people that you can really lean on, especially like if they're co-founders with you. They know what's going on as well, and you can really just put your faith and trust in them when you need to. So I feel like that's very important. Totally. Is there anyone else you feel like at the time when you were first starting out that you kind of had to like convinced that this was like what you wanted to do, that even though there was some uncertainty that you really just wanted to go all in? Or do you feel like your whole network was very supportive of your idea?
I generally feel like we had a very supportive network. I think like friends and family were just like thought it was incredible that we had this opportunity where we did have a grant to kind of take advantage of that and see what happened next. And we also had like various people kind of along the way really really reach out and provide that support. Like one of my co-founders, her previous job was a design consultancy engineering firm in New York, and they actually gave us office space for nearly a year, including like all of their prototyping equipment and all access there. So yeah, I think we really felt support from all angles.
That's amazing. I feel like that makes a world of difference. No, you have people in your corner.
Absolutely.
Do you feel like, since you started, this has been a couple of years now, do you feel like like the work-life balance has been possible for you? I know you said you're married. Do you feel like that has been attainable?
Yes. I mean, I think it's, I guess one aspect of starting a medical device company specifically is that there are a lot of like prescriptive steps that you have to follow in order to get there in terms of like the regulatory steps and the clinical trial steps. So because of that, I think it kind of also enables a really nice work-life balance, because there is only so much you can do when you are also having to outsource a lot of your testing to like a specific chemistry lab. So I think that element, like on the surface of it, is nice, as well as I would say like our entire team's attitude to making sure that everyone does have time for themselves, because ultimately I think it provides you with more productivity when you're like actually focused for the working element, if you're able to take a break and kind of be with your friends and family.
Yeah, 100%. Are there any specific things that you feel like you do when, you've had like a super tough day, you just need to like clear head so you can come back to work and be like in a more better perspective? Is there anything that you do to kind of just get that clear mind space?
Yeah, I go for a run. I live in New York City, so I go for a run in Central Park, and that always makes me feel
area.
better.
Yep.
And then I can see how anxious I am based off of how fast my like mile splits are.
Interesting. Yeah, I know. When I ask like a lot of people that question, I feel like it's either going on a walk, something outside. I feel like is a very common answer, which I'm the same. I'll go like on a walk or a run, and I feel like I can totally come back, and it's like any stress that I had is just like washed away with the wind, and it just like it's so much better.
Perfect.
Yeah, that's great. And do you feel like, obviously you have this company, is there kind of a pinpoint that you can be like, this is a success? Like, I know what I'm doing is helping all these people. Was there like one moment that you kind of had that light bulb moment? Like, this is going to be good.
Yeah, so I think so. Just to give some context of where we are in our company, is that we are currently under FDA review. So our device is not out in the world yet, but we did have to run a clinical trial prior to this. And I think kind of getting our first feedback from someone who has actually used our device for 3 months and was able to manage their prolapse on their own for their first time, and really was like speaking extremely highly of their quality of life improvements, like the exact goals of what we were trying to do. I'd say that was like kind of like our first moment where we were like, oh, this is all worth it, and we're on the right track, and like really excited to keep moving forward.
100%. I mean, I feel like especially with what you guys are doing, it benefits so many people. And I would love to know, like, if you or any of your co-founders, like, is there a reason why you guys decided to do this as your startup? Like, do any of you have a personal connection to something like this that made you be like, I want to solve this problem?
Yeah, so I think during the process of trying to understand where kind of the innovation was needed in the gynecology space, and getting connected with our fourth co-founder, who is the urogynecologist. He was actually the first one who introduced us to the condition of prolapse and the current treatment options, which are pretty suboptimal between solutions that have been either recalled or have extremely high relapse rates, or the existing non-surgical solutions that really don't allow people to manage their condition on their own. So they have to go into their doctor like once a quarter in order to have their device called a pessary removed, cleaned, reinserted. And so we kind of think it was this specific condition, likely because it is kind of an overlap of two really like underserved populations of like women and people who are going through menopause, because it does tend to affect people who are older. So we thought that this kind of was an area that we really felt compelled to focus on, because it seems like no one is really doing much in the space.
Yeah, 100%. I feel like you have to have a passion for what you're trying to solve. I feel like if you don't, then you're not going to have the motivation. You're not going to be like, I want to solve this issue. You really have to have kind of that personal connection and see the issue and see that there's such a problem in the world with it, and want to fix it. I think it's just amazing stuff what you guys are doing. That's great. Can you talk a little bit about, the process of being approved by the FDA, and just go into a little more detail on that for some people that might not know like how long it is or what that even entails?
Yeah, absolutely. So our specific process for getting cleared by the FDA is that we are doing a process called following a 510K pathway. So this is a process that happens for devices when there is already an existing device that's out there and you're providing an improvement on it versus like a new device entirely. So this kind of enables a bit of a like an expedited process to some extent, where you can also like rely on the fact that the existing device is safe, and that's kind of like your starting point. But still on top of that, there is a number of basically mechanical testing to make sure that the device can withstand any sort of like use life that's proposed, or yeah, it won't fail in a way that's harmful to a person. Then there's another series of testing, biocompatibility testing, which is often outsourced to a lab to make sure that the device is safe at a fundamental material level. Then kind of the third category of testing is the clinical trial. So after we completed the first two steps, we then ran a clinical trial, which ended up being in total about 1.5 years, because we had 62 people participate in it for about 4 months. And so that just completed in June, which then allowed us to compile all of the data that we had collected, submit by the 1st of September. And so now we are currently in the process of review with the FDA. So they'll come back with any sort of questions they have on our application, and that is kind of expected to go back and forth over like the next 6 months.
Yeah, I mean, it's so interesting. Like, even I don't know much about that process, obviously. And, I think people probably don't realize how much back and forth and how long it actually takes to finally be like, okay, whoever wants like this, like they can use it. It's a real process, obviously, it seems.
Yes, I mean, it's taken us like 3.5 years, and I would say that we have kind of one of the faster tracks in terms of getting a medical device through the FDA. So it is definitely involved.
And did COVID like affect your process at all with any of that?
Yeah, so unfortunately, COVID did stall a lot of our clinical trials because, rightfully so, practices shut down any sort of like non-emergent visits, as well as any clinical research. So we were paused there for a bit until that happened.
Yeah. Were so many people, of course. It's just like, it was crazy with everything, and I can only imagine how that affected you. So, of course, that makes a lot of sense. Kind of switching gears, I would love to just kind of hear about, how, if you feel like there's any sacrifices that you've had to make, and, what you've been doing, if you feel personal or professional, in your life, sacrifices to get to where you are today.
Yeah, I mean, I think especially with like a 4-person team, everyone kind of has to fill the roles that are necessary for the company. And I would say that there are days where I spend the entire time probably working on some kind of task that ultimately seems like it would probably be automated if we were at a larger company, but because we're at a 4-person company with a startup budget, it is not. So I would say that there are days where I would say that, ultimately it doesn't feel like a sacrifice towards the end goal of getting our pessary out as people who need it. But I would say that, personally, there are days where like I don't feel nearly as like challenged or excited about the work that I'm doing. Instead, I'm doing kind of like the elements of running a company that are a bit less glamorous, and ultimately probably don't promote like my career goals.
I feel like that makes like the little successes and the nice moments where you can step back and be like, I love what I'm doing, that much more important. Because you really have to have those moments to keep you going and want to like keep doing everything that you're doing. So no, I totally agree.
Perfectly put.
Yeah. Well, it's nice because you have like, your other founders. So you guys can kind of like pass around the different jobs that might not want to be the most fun, but have to be done. So that definitely helps, I'm sure.
Yes, it is nice.
Totally. I would love to hear a little bit more about like if you know, like we talked a little bit about like the sacrifices, but is there any feel like challenges or things that you've had to overcome with starting a business? Could be general, could be very specific to your company, but just like overall challenges, struggles that you feel like people who are starting their own business might have.
Yeah, I feel like there are a lot of elements of what we've had to overcome over the years that it was kind of like if we knew what we were getting into in the very beginning,
Hmm.
there was like some element of ignorance is bliss, absolutely.
Yeah.
And like we've been able to kind of like take things in stride as they've come. But I would say that um, yeah, some like different elements of the regulatory process of setting up a quality system that is like keeps track of like our entire design process as well as our manufacturing process that can be
Hmm.
audited by the FDA at any point. So making sure that like we're kind of like following the exact steps to become a medical device manufacturer has
Right.
definitely been an absolute challenge. I would say that also we have been like fully grant funded, and while like it's I think like the fact that we have been able to have exclusively non-dilutive funding has been like extremely fortunate, and I think has benefited us in a number of ways, especially
Hmm.
being a medical device company that can be slower moving than your typical than other types of startups.
Right.
And I think like learning how to write a grant successfully so that it is
Hmm.
funded and that you can ultimately rely on that being your source of funding also has been
Hmm.
an extreme challenge. So yeah, we just received our third grant in the past couple of months, and so I
Amazing.
thank you. So I feel like we're getting the hang of it, but like
Yeah. Hmm.
I think that's like been a huge learning curve over like the past 5 years.
Totally. I feel like failure is such like a common theme with entrepreneurs. You know, whenever I talk to people, they're always like, "Yeah, you're gonna fail." It's honestly good if you fail because, especially in your case, like you need to know what your missteps are so then you can make them better. Especially since these are like people's lives that you want to be helping. So it's even more so important in your case. I feel like, but I feel like it always helps you become better. You learn from your mistakes, can improve in any way you can. And at the end of the day, I feel like failure, it's a good thing.
Yes, absolutely. And yeah, I would say like even yeah with our like grant writing, it's like really nice that it's like that's like kind of like a perfect avenue for that example because like you get feedback
Hmm.
when you're unsuccessful and then you have
Totally.
like, exactly what you need to fix to try and
Hmm.
like, actually
Yeah,
the following time.
100%. Do you feel like there's been any mentors in your life that you feel like, I know you have your co-founders, so you can lean on them, but anybody who, you know, you feel like you guys can look up to that's done this before and that gives you guys valuable advice?
Yeah, so Rick Greenwald of Simbex has kind of been with us all
Hmm.
along, like even before we wrote our first grant, which was like a really interesting experience where, yeah, like this is like fortunately we were like caught before we like actually submitted in terms of like but we wrote up a whole draft that we were intending to submit, gave it to him
Yeah.
kind of like the week before, way too close to the deadline. He basically came back and told us to rewrite the entire thing and
Oh my
essentially
gosh.
like, pulled an all-nighter to rewrite our grant and
Yep.
then submitted it the next day. But
Oh.
I like that, like also just like that mindset of like where I feel like he gave us that feedback because he knew we were
Hmm.
capable of ultimately submitting something that would be successful. We just hadn't
Totally.
done it correctly and hadn't like
Hmm.
learned how to do it correctly the first time. So I would say like from the very beginning, like that has kind of been like the attitude in the relationship, which has been like very, very helpful.
Hmm. Well, I just feel like it's very critical for, you know, first time founders to have someone who's been through the process, has made 100 failures and mistakes, and knows how around them so you don't make them. And then just someone that you can like talk to if you're having a hard day and be like, listen, then they can tell you to keep going. It'll all be worth it. And I'm sure they can see the positive energy you guys obviously have and the great things that you're doing. So it's always nice to have someone that you can look up to and really just go to for advice.
Absolutely.
Yeah. So kind of like a fun question. So let's just say that you just sold your company for 8 figures.
Mm-hmm.
Where would be the first place you would travel to, or what would be the first thing that you would do?
Yes.
No responsibilities. Just yeah.
I would love to go to New Zealand and do the trek that's essentially like across the entire country, like from the north to the south. So yeah, really try and yeah, spend significant amount of time in nature.
Yeah.
But yeah, so hopefully in a couple years.
Yeah. Are you a big traveler? I know you said that, you and your husband went to Japan. So do you guys
Yes, I
like
mean,
traveling?
yes, I feel like we try and like get in a trip like once a year. And yeah, so do you enjoy traveling as well?
Yeah, no, I love traveling. I love seeing different cultures, and I'm sure that also, helps you in some ways because you can see how other women are living in maybe impoverished countries or different ways and how you can help them with what you're doing as well. I'm sure that's like very important
Yeah,
also.
absolutely. Yes. I mean, like prolapse goes untreated in a lot of countries, mainly
Totally.
because they can't access either the regular care to manage the current non-surgical solutions, or they
Yep.
can't access the surgery. So we are really hoping that our device would enable more care like in rural and like communities across the world.
Totally. So amazing. So amazing. So kind of just to wrap up here, I would love to know if, I'm obviously 18, moved across the country to, start my startup. Would you give me or anybody, watching who wants to just kind of dive into this world any advice that you would give us?
Yeah, I mean, I kind of feel like it's I feel like as long as you kind of are, it feels cliche, but as long as you're like passionate and you're like driven by
Totally.
what you're doing, I really think
Hmm.
that can ultimately help you work through any obstacles that come your way. I think it's like there are going to be a lot of like extremely hard days, but I feel like
Yeah.
kind of like making sure that you have the right people and the right team around you who complement you and support you, and like you together are all aligned with this like one goal, like really
Hmm.
does kind of help you get through like those tough spots.
Totally. And I can see that from you with your co-founders. It obviously, can see how much that helps in the long run. So no, this is amazing. Thank you so much, Kaitlin. This has been so amazing to get to talk to you and learn more about what you're doing. It's been a pleasure.
No, thank you so much, Grace. This has been really fantastic. I've really enjoyed it.